info session first? What are your thoughts about that?
Whatever you prefer. I mean, I think
We
that's
didn't have time to do the info session on whatever day it was, Monday. I'm losing track. Hi, Eileen.
Hello.
So Eileen, should we go ahead with the plan to do the info session first?
I think we should, even, if it's a little bit abbreviated, just to make sure you're leaving enough time for the pitch, because we didn't get to it yesterday or whatever day that was. So I think that we should.
Yeah, I think people need, okay. Hello, everybody that's coming on. We're still planning for you. And the people that are on, have you been to an information session? If you can just raise your hand. Yeah, so they're probably, they haven't been. So I'll go ahead and do the info session first.
I just walked in the door, Eileen.
I was going to say, Nico, you made it back.
I literally.
You look pretty good too for all that traveling.
Thank you.
Welcome, everybody. Happy Friday.
And a beautiful one it is.
It really is. It depends where you are, though.
Only 2 Fridays left.
That's how fast this went. It was just unbelievable.
Right. I could not believe it.
Is that your read eye, Nico? Somebody else can just.
Yeah.
I think it's Isha's. Oh.
Want to give it to 3 minutes past PM? Is that
yes. Okay? Yes, we're just waiting for people to come on, everyone, and then we'll get going. Hello, Alyssa. Where are you from? See, I like cameras. I like to see people.
Hi, how are you?
Good. How are you?
Great. Nice to see you.
You want to tell everybody where you're from?
Oh, sure. Yeah, my name is Alyssa.
I mean, I know, but I want somebody else.
Yeah, my name is Alyssa LaFleur, and I'm a nurse on the inpatient psychiatric unit at Massachusetts General Hospital.
Excellent.
Welcome. Thank you for coming.
Thanks. Good to be here.
Jill, you want to introduce yourself? Whoever's camera's on, I'm going to have you introduce yourself. So,
sure. Hi, I'm Jill. I'm a psychologist at the Lurie Center for Autism at Mass General.
Excellent.
And who else? Oh, go ahead. Sorry, Nico.
No, I was going to say that the NurseHack4Health pitches on in Brazil. 2 of the awardees were actually their solutions were for autism. So very curious to see your application. Yes.
Frida and Chica, where are you from?
Hi.
Hi.
Chica here from Atlanta. Well, I live in Atlanta, Georgia. Originally from Nigeria, and I am a nurse with my own organization called Utopian Healthcare. I still believe in the utopian idea.
Oh, great. Welcome.
Welcome.
And I'm Frida. I'm from Texas. I'm a labor and delivery nurse in San Marcos.
Hi, Frida. That's what I did
Hi, Frida.
most of my career, way back
Ah.
when.
Nice. Yeah, time flies.
Yes. Nico is my boss from San Ciel. He'll let us know when to start. And Eileen is also on the organizing committee. She's from Johnson & Johnson.
And she's all of our bosses.
And she's all of our bosses. Whatever she
Very
says,
funny.
we do. Just for everybody attending, I'm going to do an information session first, and then we'll go over the pitch and how to pitch your idea, and also we'll give you the template that you have to use. So we're just you want me to get going, or should I go ahead?
Sure.
Okay.
Yeah,
All right.
and just a
Everybody can
reminder.
see. Yeah, go ahead.
Sorry, Ham. Just a reminder that this session is being recorded and will be made available on the NurseHack4Health homepage. So you will have access to help you finalize your pitches before submitting your applications.
All right, good. So I'm turning my head because the the screen is here, so I'm not ignoring anybody. So welcome everyone to the NurseHack4Health, and you can see my screen, correct?
Yes,
Just give me a nod. Perfect. So today our agenda is we'll describe what the NurseHack4Health is, exactly what is a pitchathon, some of the pitchathon key activities, and the education support we provide, in addition to the pitch flow and the judging criteria. And then we'll give a few minutes for questions and answers, although we have lots of Q&A on the NurseHack4Health.org website, in case, because then I'll have to jump right into the pitch so we get everything done today. So the overall goal really is for all of you to take it apart, fix it, and build it better as we know you can. And this is presented by Johnson & Johnson, Johnson & Johnson Foundation, San Ciel, and Microsoft. So what is a NurseHack4Health? So really our mission is to unleash the power of nurses as innovative leaders and problem solvers to address the world's most pressing healthcare challenges. The theme, again, as I've said, is take it apart, fix it, build it better. And again, the goal is to really create a thriving workforce in healthcare, a healthier work environment, and better patient care. So our underlying magic, of course, because we're NurseHack4Health, is nurse-led. We use design methodology. We really welcome diverse perspectives. These are inclusive events. It's open to all, free applications. We encourage interdisciplinary teams, and we provide support, educational, coaching, and volunteers. So just a little bit of history over the 5 years that we've been doing NurseHack4Health. We've had over 5,700 nurse participants from 66 countries, over 400 hacking hours, and we've had over 14 plus NurseHack4Health events, and greater than $1 million in grant funding for nurse-led solutions. So what is a pitchathon? So what we want is we want you to all form a team, and we want you to work together. We want you to make sure it's interdisciplinary because that's where all the magic happens. Identify your problem, create the solutions, and then pitch your ideas around the thriving nursing workforce. And why should health systems and nursing organizations and nurse-founded startups participate? Because you're going to be solving for foundational challenges to create that thriving workforce, provide an opportunity for ideating and generating new relationships and ideas across your organization is what we hope that would happen. And then the opportunity for Pitchathon finalists to receive up to $385,000. That's in total, and I'll break it down for you shortly. Okay, so this year we have 3 tracks. The first track is health systems and nursing organizations from high resource countries. And again, this is open globally. We have the second track, which is the same amount, but for health systems and nursing organizations from low to mid resource countries. And I'll go over how you go in and find that out. This year, we're really excited about providing up to $35,000 for US-based nurse-founded startups. And this is for the US only. So who's eligible to participate? So global health system and nursing organizations, but you must be a 501c3 or equivalent. And the high resource country, we have a resource guide, a country resource guide at NurseHack4Health.org, and you can, establish whether you are from a high resource or a low resource country. And again, we want you to include your nurses, your nurse leaders, information people, grant and funding office, and anyone who you feel needs to be on this team. Track 2, again, is the same requirements, but it's from the low and middle resource countries. Again, you can find that at NurseHack4Health.org. And then the third track is the US-based nurse-founded startups. You must be registered in the United States with a valid bank account, must have less than $50,000 in capital, and must be nurse-led. And again, the same goals is that your solution should be creating or helping create a thriving workforce and healthier work environment. Okay, so the applications opened August 18th. And so what we need from you is, if you've gone on the website already, it is an application and with a slide deck. And I will show you the mandatory slide deck that you do have to use. So the Innovation Academy is occurring now. So if you haven't been able to attend other sessions like AI from Microsoft, how to build a budget, etc., everything is recorded and you can always just go and listen to them asynchronously. Your final proposals are due September 30th. And then we will notify the finalists on October 11th. If you become a finalist, we will also have what's called the Innovation Accelerator Program, and that's where you will have coaches and mentors assigned to you. They will pressure test your innovation. They'll look at your budgets that you are creating. They'll help you practice your pitches. And then for those that are eligible, and I'll go over this, you have to submit a CAF America application by October 30th. So the Innovation Accelerator will happen between October 15th and November 10th. And then the final day where you will live pitch virtually, meaning you will go on camera and you will pitch with your teams to judges. And you will find out that day whether you are a winner. So everyone has to attend one information session, and that's today that you are attending. There'll be another one on September 18th. So anyone that's applying, not every single person on your team has to attend, but at least one of you has to attend. Okay, so this is what we've had. So Marion Leary did design thinking. Again, all these are being recorded just as today, so you can always go back and listen to it. And that's today. This is the final one. And then for those of you that would love to earn 2 CE credits, we do have the NurseHack4Health Innovation Academy. And these are 3 things that you can listen to asynchronously and apply for CE credits. And we really encourage you to do that. We're also going to have office hours. So let's say you need help with your budgets, or you have additional questions about your pitch or whatever, you can sign up for office hours. And these are some of the dates. Again, you go to NurseHack4Health.org schedule to sign up, and it's a QR code here. And then you can ask for particular coaches. You know, maybe you want a designer or pitching help, healthcare, engineers, and things like that, and we will try to get them to you. I'm going fast because I have to do the pitch thing too, so sorry. So what is entailed in the pitch? So we really want you to start with a story, and then you're going to tell us what your problem is, and then what the solution is, and how it compares or fills the gaps from everything else that's being done, whether it's currently being done or something in the market that's being done, and how does your solution make that impact, fill the gaps. We want to hear about your budget, and I'll go into this a little bit more detailed. How are we going to sustain it and scale it? You might start in one unit or a certain patient population. How will you expand that later on? We want you to dream big. You will let us know who's on your team, and then we want you to come up with a big closing. This is the evaluation criteria here. Again, this will all be available to you on the website. So this way you can really speak to this area here, the excellent. So this is what you should be attempting to do. Okay, so we have lots of Pitchathon resources on the landing page. Again, it's NurseHack4Health.org. Pitchathon resources. That way you can, that's where you will go to get all that. And our ask is to really think about critical high impact problems to be solved. How could your health system organization startup solve for? Again, take the Innovation Academy, earn 2 CEs, and we want you all to apply and spread the word for us and follow us on social media. And this is for more information. Again, NurseHack4Health.org. There's also a bunch of things that Johnson & Johnson has put out, and here are the links, nursing.J&J, allinforhealthcare.org, and J&J with BBC has done a film, again, with one of our winners from last year. Okay, so I'm going to open it up for a few questions. Oh, I did that in 15 minutes. Okay, we have some additional time. Are there any questions from what I just reviewed? And you're welcome to put it in the chat, and Nico is also monitoring that with Eileen. Happy for you to come off mute if you have a question as well. I did a great job, huh? Okay, all right. So now, by the way, I'll just show you, you know, what the funding can be used for. Again, this is all on the website. If you want me to, I can go through this very quickly just because we have some time. So the funding may not be used. I think it's easier to do what you can't use the funding for, which is baseline research or exploration. These are not planning grants, but rather we want you to be able to implement your solution. And the grant that you will get is from January of 2026 till December of 2026. So that's the implementation year. We also want to hear about how your institution and will continue to support you beyond the first year. What is a fiscal sponsor? So some institutions are not a 501c3 institution, but can collaborate with a 501c3 institution. So if any of you are in that things, we have a answer for that. Oops. Can the funding be used for staffing and salaries? Yes, it can, but it cannot exceed 30%, including overhead costs. And sometimes what we really encourage is if you don't need the total amount of funding, then please don't ask for it. And that, because that allows us to maybe give out more than one team. If you need more than that, it's okay to list that, but what needs to be communicated is how your institution has committed to the funding beyond the 175,000, if that makes sense. So if you need 200,000, we need assurance that your institution will put that money up. All right. So again, these are really important things that you should probably just get on the website and really digest. Okay, so I'm going to pull this down and then we'll go into the pitching. Okay, you still can see my screen, right? Okay, good. All righty. Okay, so when you apply, again, the application will go along with a slide presentation as well. For the live pitch, you will be doing the same presentation, of course, modified probably from coaching and mentoring with your team live. And so there'll be some minute changes, but I'll go over that. So what I want you to think about is think about yourselves when somebody is telling you a story, how you really listen to that and you remember it, it resonates with you. And it's the same thing with your pitch. So we want you to tell us and thread your storytelling throughout the entire pitch. How did you come about that you thought this was a problem? Did something happen to a patient? Did something happen to one of your colleagues? Like, what happened? And tell us that in a story format. Again, it should thread through the entire presentation. You want the audience to really want to partner with you. You want the audience to want you to win, and you want the audience to want to help you to solve this problem. All right. I always like to think about the pitches in a framework, which is the 4 H's. A headline, pulling at the heart, which is where your storytelling will begin. The head, which is the statistics, the research, etc. And then hope, which is how you end it, because you want, again, the audience and the judges in particular, that they love your vision and they want to collaborate with you and they want to see you go forward. Storytelling has usually 3 acts. So again, the setup, how did you come to this problem? Why do you do this? Why now do you want to solve it? And the struggle is, what's the competition out there? How is it currently done? Why it's not working? And how your solution solves the problem and fills the gap. And then, of course, at the end, you want to wow the judges, highlight your team and their skill set, etc. So headline, setting the contest, and Lumify was our winner in 2019. And you can see that they had this name, brand logo, or whatever you want to call it. But then their tagline kind of gives you an indication of what their solution is. So it's a marketplace for healthcare workers. So you can more easily find, share, buy all the gear and resources you didn't know you needed. Okay, so think about a team name and have fun with this, okay? So the heart, make me feel something, okay? I want to understand the problem you're trying to solve through story, okay? And then tell us, how big is this problem? If I do patient falls, it's a $50 billion problem in the United States. So give us those real statistics and data. And how are things being done now, and why does it not work? And if there's anything out in the market, how is that competing against you? Okay. Your head. Okay. So this is where we want to hear about your solution. And again, we want you to start small. So before we get to the car, right, we started with a skateboard, but you're trialing it and everybody's falling off. So now we need a handle. And now you need, really bigger tires and a seat to sit on because everybody's getting tired. So you see how it develops. And this is why we say start small in what you're trying to solve for, and then tell us how you're going to expand. So, and how it works, again, the current competitors, what kind of investment, think about who's going to pay for this, how this is all going to work. And then again, about scalability. And then your hope, your last slide should be your team members, their skill set, your big close, and what do you thread back that story in the beginning and how your solution has now made this patient or your colleague or whatever happy and satisfied, and walk and, review what you want the judges to walk away with 3 things. Okay, so the pitch presentations, please put your best pitch person in front, okay, to pitch for you. But we don't encourage more than 2 pitch presenters because you won't have that much time and you don't want to waste the time going back and forth. We tell you not to embed any videos because honestly, they never work and something happens that eats up the time. Always be prepared for questions, less words, more pictures, etc., and speak to your pitch. Okay, so now we're giving you this slide deck. Again, it's on the website. You will have to use it. And then you can, of course, get rid of these sort of things that are written here, but we've done some note taking and how much time when you're pitching to spend on each slide. So we went over this already. So only up to a maximum of 14 slides. Eileen and Nico, remind me again how many minutes the teams have to live pitch if they make it to the finalists.
5 minutes.
5 minutes?
Yeah.
So you can imagine you have to get your pitch, everything across in 5 minutes. So here is the template. Okay, so you do your project title and logo. Again, erase all this once you do it. Again, you start with your story, and this is to really walk you through the pitch. When we give you tips along the way, and if you're live pitching, again, you should only be spending about 45 seconds. Again, please erase all of this once you're put in your information. Your opportunity and problem statement. What is the problem you're trying to solve? How big is the problem? Who does it affect? What is currently being done and why isn't it working? So provide some context here. Again, only about a minute that you should be spending on this. Your proposed solution, and this is really where you want to spend most of your time, right? You want to get across how this is going to work. So describe your solution clearly and concisely and break it down because not all the judges will be clinical. Not all the attendees, again, will be clinical. So really walk people through. Highlight key activities, primary outcomes, make sure that you have the ability to, measure things and using the SMART phrase, specific, measurable, achievable, relevant, etc. Describe the contextual inquiry or research you've done already so let's say some of you have already piloted. What are the results? That's really important, and that would really be meaningful, and how you've advanced from that knowledge that you achieved through piloting and prototyping, etc. We want you to have a competitive slide. We just put this in as an example. But we're happy if you wanted to use, but you should have a grid. Over here on the left, we just put in intuitive design, cost, performance. These things you can change according to what your solution, what the benefits are from your solution. Then compare it to what is being done. And sometimes there's nothing being done. So you can state that, but state that clearly. There is no competition. Nobody's doing anything about it. Or if there is competition, what do they meet and what is missing so that your solution visibly stands out, that you've addressed all those things. Does that make sense? Okay. And the impact, describe the overall impact of your solution, how it will be measured, how is your solution increase nursing satisfaction, patient satisfaction, or patient safety and quality, all of that. It doesn't have to be satisfaction per se. Okay, and then the budget is really important. What I always tell people is just sort of make a list of everything you need and then back into the pricing, because that will help your budget process. But I would definitely go back. Drexel did a video on budgets, so that's been really helpful. So you can look at it. So it has to be detailed, and I'll show you an example of the budget. And then for years 2 and 3, sort of high level, if I were to maintain the solution beyond year 1, this is how much money I would need. And then, of course, describe how the project will continue to be funded. And if you can get, for those of you in institutions, your leadership to agree, it does go a long way. Here's, again, this is just a example of a budget. You can change all this down here on this column. But this just gives you an idea, like, do you need equipment, supplies? What is it? Salary, things like that. And then your total project cost for year 2 and 3. Sustainability, again, how will it be sustained beyond year 1? And just as a reminder, you will utilize the money January 1st to December 31st. And, again, securing senior and executive leadership support. And then the team. So for the application process, you just describe your team members. You can name them, but no images, please, because the reviewers, we don't want the reviewers to see any images and stuff like that for the team members. However, when you do your live pitch, if you become a finalist, then we would love everybody's photo on this last slide and their skill set underneath. Okay, and then you're closing again. What are the 3 things you want the judges to hear, and how your solution has really solved, and go back to your problem and how it was solved. And then again, this is the evaluation criteria. And again, more information, what I showed in the information session. And then I'll open it up to questions. I know it's a lot, but you'll have a lot of help. You just ask for it. We're all here for you. Does the slide deck look reasonable and doable? Good. Okay, I'm going to stop sharing so I can, there. Can't see anybody when I'm doing this. All right, either I did a really good job or you're all tired on Friday.
You did a great job.
Yeah, please, please, please don't hesitate to reach out to us. I think the application is fairly straightforward. And we tried to have it aligned with the pitch deck as well, so.
There's a question on where they can see the evaluation criteria.
So, yeah.
In the pitch deck. Do you want to flash it back up?
Yeah. Let me just bring it up. So the criteria really is, the potential systemic impact on creating a thriving workforce. How innovative is your idea? The implementation feasibility of the solution. Yeah, I apologize. I should have gone through this a little slower. And it is embedded in the pitch template that you will have access to. Sustainability, team strength, and then how you will be measuring it and reporting out.
I had a question.
Sure.
It's regarding the idea of this is not for planning, this is for implementation. I'm in the nurse category at this point. I don't have an institution behind me, but I am imagining that part of the planning or part of what I would use the funds for is building a prototype, selling the prototype, getting more funding, getting it bigger somehow. It's just like that thing you were talking about the bicycle versus the car. Is I am still learning how to do this. Like I'm a nurse, I'm a bedside nurse. I don't know how to build software. Like I would have somebody on my team that knows how to do that, but how intense does the prototype have to be implementation versus planning? There will be several months in which I'm figuring out what I need to do.
Yeah, and I can tell you this, we did a project similar to what you're talking about, and we did it on paper first. So we did it on paper. It was an Excel sheet. It wasn't anything fancy, but we learned a lot from implementing that. We got feedback. Oh, this is, we can't find where this Excel, where the Excel lived. So now we need more of them. And it would be great if we had an app. And, so you're getting, so it doesn't have to be that you already built something, but rather you have to have an idea of what you're going to implement to get your feedback. And innovation is all about iteration, right? Put it in the hands of the people. Learn from it. Go back, and your solution would get better every time.
So when I'm pitching, I can pitch for the idea of the solution and not be super clear about at the end of this project, I'm going to have an app. Like it can be something where I have put the things in place to build it or figured out how to build it.
Yep. So you have to show something, even if you're thinking of an app, you can, is it Figma, Nico, that they can go on and build sort of like a wireframe or something to show?
Exactly.
Right.
Like I could do a simple prototype, but the one that I want to eventually launch is more complicated than I can imagine pitching in 2 weeks.
Right. But once you implement that, and then you're getting feedback from whoever you're going to implement it with, your solution might change 100 times.
Okay.
And what you had envisioned would be the solution may not be once you put it in the hands of others. And that's one thing we learned.
That's cool.
Yeah,
Thank
it's
you.
really cool. You're welcome. Chica?
Thank you, Hiam, correct?
Yes.
Thank you for the presentation.
Everybody was afraid beforehand. They would always be afraid to address me, so I had to do it so that they can pronounce it. So
that was very helpful, because I would have said that what you usually hear is Hiam, right?
Yes.
So I do have a couple of questions, and thank you,
Sure.
Frida, for answering your question about already having something versus planning. One of the first question I had was, do we come back at the end? Let's say, there's a winner's year, a regroup at the end of 2026 to say, hey, what did you do? How did it go? Any lessons learned? Or there's just no touch point after the announcement for winning?
Oh, so you mean if you're a winner, will there be? Yes, there'll be several touch points. Nico, do you want to expand on that actually?
Sure. So for the full 12 months of the implementation phase, you will be connected with a mentor through Sanciel, and you'll be provided a project plan where there'll be monthly checkpoints. There'll also be like quarterly reporting that's due to make sure that the implementation phase is all on track and you receive the support that you need to be able to utilize the funding for your solution.
Thank you for that. The other question I had is, so for my organization, and I'm going for the low middle income country application, and we are doing so much from can one organization apply for multiple things? For one end, we're training people, on the other end, we're doing NCDs, or is it just one organization for one application? Or is it based on the problem? Because we're solving like 7 problems.
You could. That's wonderful to hear, Shika. So you are allowed to have multiple applications from the same organization, and that goes for health systems. We do actually really encourage that if you have other nurse colleagues that may be interested in the programming from the same institution, to please submit their application as well.
Very good. Thank you so much. And the non-for-profit equivalent, I'm not sure. I love the list you guys gave to identify low middle income country. I was hoping for some clarity on what does equivalence mean. Is there a foundation if you have like because countries, they have different rules. It's not always the, and even when you ask for the numbers, the tax ID number is quite different. Is there anything that we would have to make sure that we fall into we are in the right categories as you would require?
Yes. So during the application process, and everyone is able to access the application currently, you can actually start and save it, their progress throughout. We do require documentation to be submitted. So for example, some of the other countries outside of the United States have like a public charity registration document that they're able to upload, or an institutional charter, which highlights that the scope of the organization or the system is not for profit.
Thank you very much.
You're welcome. We're so excited to hear of all these applications. And I think Nico put in the chat that there were 10 finalists out of 87 applications received last year, right? Yeah.
Yes. The structure was completely different last year.
Yes.
We did not have tracks. It was open globally. This year, we wanted to make sure, due to the significant increase in grant funding that was made available from Johnson & Johnson Foundation, to implement the tracks for a more equitable program across countries, as well as different types of applications, such as startups and organizations.
I should mention, because this question usually comes up too, people sometimes are worried about intellectual property. This is an open innovation. So if you are concerned about intellectual property, if you already have something and you're trying to patent it or whatever, then we would ask that you don't share anything that's that you would be worried about.
Yeah, don't share confidential information. People have applied for IP, during the process and after, but do not share anything confidential. And then we also suggest that you talk to your institutions about this as well, because they may have other guidance to give you.
Hi there. Can we get a little clarity on the confidential part? Because I feel like you can't compete in this competition without disclosing what the product functionality is. And if then you're concerned about intellectual property, then you've already disclosed pretty much the core of your idea.
Well, I can tell you, like for our institution, what I tell the teams is, because lots of times we meet with industry, we meet with others to go over our idea, because we want to know if they're going to license it or collaborate with us. So you just keep it very high level, meaning, and that's what you're going to do here. But let's say there's, the IP is and all the algorithms within and, you know, a very high level app or something. You don't want to go over the detail of those algorithms, right? You don't want to go
Right.
over like, so that's sort of what we mean by not disclosing, you know, so it's that deeper level of how it works and how it this and that, but, you know, just overall, you know, this is what we're trying to accomplish. This is the problem we're solving, and here we're going to implement it, and here's how it's going to work. And then again, Amos, you can meet with us and go over your solution, and we will let you know what you should and shouldn't, or how you can rephrase things so not to disclose anything. Because if you make it to the finalists, the live event is seen by hundreds.
Okay.
Everybody will be joined. Yeah.
Good to know. Thank you.
No, but they're all important questions.
If anything else comes to mind, of course, we are available. I'll drop again the support email in the chat here. We also have office hours available in the event that you would like to meet with team members or specific mentors, whether it's for technology or if it's with him for your pitch development, et cetera. So please do reach out to us and use those resources that are made available for you.
You're also very welcome. Have a great weekend, and looking forward to, we're not reviewers or judges, but we like to read your applications.
Best of luck to you all.
Thank you.
Thanks for joining.
Bye.
Have a great weekend.
Thank you.
So cute.